Good day everyone, I'm Ethan, moderator for this webinar. Welcome everyone for today's webinar, Navigating the 2023 Medicare 855 Enrollment Form Updates. I would now like to introduce our presenter for today, Tony L. Holmes. Tony L. Holmes, CCS, CPC, CPMA, CRC, AHIMA approved ICD-10 CM/PCS trainer, is an internationally known speaker and recognized subject matter expert on medical coding, reimbursement, and revenue cycle management. She is the founder and CEO of Alpha Coding Experts LLC. She holds multiple credentials with the American Health Information Management Association, AHIMA, and the American Academy of Professional Coders, AAPC. I would now like to hand over the floor to the speaker. Over to you, Tony.
Thank you so much, Ethan, and thank you to all of our attendees today. It looks like we've got a pretty good sized audience. We're going to be talking about the 2023 CMS 855 form updates. So we've got a lot of information to cover in our session today. So as Ethan mentioned, I'll be your presenter today. My name is Tony L. Holmes. I really enjoy teaching these sessions year after year, and it's always nice to, make sure that your organization is doing things compliantly and efficiently, and you are maximizing reimbursement. So part of that is making sure that your form filings with Medicare are appropriate and accurate. So we're going to talk about the key updates. We're going to talk about some of the common challenges in the form files. We'll talk about supporting documentation, and then we'll go through some best practice tips and compliance considerations. So before we actually get into the forms, I just wanted to give you kind of a high-level overview of what's changed in 2023. Another pretty epic change is there are higher levels of scrutiny that are being looked at for certain provider types. So we've got our 4 different form types that are highly misunderstood. I think a lot of folks struggle with which form do I do, and is it multiple, is it 1, is it 2, is it 3? So I'm sure everybody knows this, but just as a reminder, you do not submit your 855 forms to CMS. You submit those through the Medicare Administrative Contractors. And then here's an updated list of the MAC. So when you're actually completing these forms, you need to have quite a bit of stuff done before you start that process. There's 2 methods for completing this. You can do it through the paper forms, or you can do it through PACOS, the online portals. So NIPS, this is the registry. Anybody can access it. It's publicly available. But if you need to find NPI numbers, let's say you've got a roster of providers that you need to get through, you could go here and you can get those provider numbers and the taxonomy codes attached to them. And then this is what the PACOS portal looks like. And in terms of the entity type for your NPI, so this is something that I think a lot of folks struggle with is, so the surrogate program is something that I highly recommend if you're somebody that is responsible for doing credentialing, enrollment, that kind of thing. So if you're a surrogate, again, there's a lot of advantages to having this kind of access because you can make changes in the PACOS portal. So 2 terms that you're going to need to be familiar with when you're looking at these 855 forms are the authorized official and the delegated official. In terms of due diligence, make sure if you're bringing any providers on, or if you're bringing any employees on, or even the people that you have on staff, you need to make sure you're doing regular checks. So as I mentioned earlier, make sure you type the answers and you sign the applications in the signature sections with blue ink. Don't miss any revalidation deadlines. And then check, double check, triple check these applications because it's really easy to make mistakes. So if you are opting out of Medicare, you'll need to make sure that you are completing an affidavit to opt out. And then if you've got a billing company, make sure you disclose that. We've talked about that already, but just make sure you disclose that in the subsection or section 8 of the applications. Thank you so much for your time and attention today. I wish you all the best in your CMS enrollment updates, and I hope you have a great rest of your day.
Thanks, Tony. That does conclude the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day ahead. Bye-bye.